like 30 to 40 of the nurses. So that was pretty awesome individually for them to do that.
That is awesome. That is awesome. So now what I'd like to do is, in keeping with Kiwanis tradition, I'm going to turn it over to Tim Jester, and Tim is going to offer up a patriotic song.
All right. It might look like from the background that I'm not social distancing, but I promise I am.
I'm going to stay muted for the benefit of everybody.
Thank you.
Ask Michael Johnson to mute as well.
Out of this.
All right.
No, thank you.
Oh,
Wow.
Well
Tim,
done, Tim Jester.
You are gifted.
Did anyone else hear the planes fly over?
No.
Yeah.
That's awesome. Thank you for that, Tim. And now, Stephen Frosen, are you on here with us?
I'm here, buddy.
Excellent. Good to see you. Stephen is going to welcome our guests, and also we've already had a few brags, but we're going to open it up to brags for all of our members.
Well, I don't know that I know who may be on, who's a guest, so I'll just say, speak up and welcome yourself if you're here, or if you're a member and you have a guest joining us electronically, please introduce them.
Hello, this is Dr. Ming Wang. I'm on the air with you all.
Dr.
Hello,
Wang,
Dr.
we're so
Wang.
happy you're here. Thank
Yes.
you for joining us.
I don't see your face.
Yes, I don't know how to get my face on it.
We
On
better
the
talk
bottom
you
left,
through that then.
On the bottom left of your screen, Dr. Wang, if you move your mouse, you'll see a icon of a video camera in the bottom left of your screen.
Okay. Yes,
And you click on that.
I did. You
There
did.
you are.
There you are. Wonderful.
There you are. Yay, Ming. Stephen, I have a guest, Brett Hansen, who just moved here from Salt Lake City 2 months ago. He has a company called Cost-Seg Authority. Brett, you want to say hi?
Hi, I also want to introduce myself. My name is Mei Han. I'm the director of the Center for Chinese Music and Culture at the Middle Tennessee State University.
Wonderful.
So I'm joining you from Murfreesboro.
Yes,
Welcome.
Professor Han. Yes.
Hello.
Hello and welcome. We're glad you're here. Thank you for joining us.
Great city to be in.
Kind of quiet downtown. I was expecting a little more people.
I'm also a guest today. I don't know if you can hear me.
We can.
I'm Eddie Poole with Keller Williams in Mount Juliet.
Welcome.
Hello, Eddie. Hello, Eddie. Welcome.
What's up, Eddie?
Hey, Dr. Wang.
I'm also a guest, and my name is Alana. I'm with Dr. Ming Wang. So I do all his PR and marketing.
Hello, Alana.
Hello, Alana.
Hi.
Hello, Alana. Do we have any others who are
Hi,
joining us? Ben?
My name is Ben Bohannon. I'm here. I'm on Dr. Wang's mailing email list, and I just saw this meeting, so I wanted to check it out.
Wonderful. Welcome.
Welcome.
Yay.
Welcome, Phil.
All right. Do we have any others who are new to Kiwanis today? No? Okay. Mike, do we have any time for a brag if we haven't already done that?
Let's do 2 brags.
Hey, this is Michael Johnson. Can I get in on the brag there?
Yes, sir.
I'm so glad that Alana Gramad is on the broadcast today. She is one of Trevecca Nazarene University's finest young alumni, and she works there with Dr. Wang, and we are just incredibly proud of Alana. She's, one of the most outgoing and genuinely uplifting young people you'd ever want to meet, and we're really proud of her over there at Trevecca.
Thank you, Michael. I'm so glad to be here.
I second.
Yeah.
Ed Holt, do you have a brag?
I do. I just wanted to brag on Joe White and all the bootstrap board and everybody about that fabulous story that's in the bulletin of this man. Great success story. Terrific.
That's great. I suppose we should all we could all brag on all the medical folks on the front lines who are treating a lot of very sick people and putting their own lives at risk. And man, I've already thought about Outstanding Nashvilleian of the Year 2020, and we're going to have a lot of options for a lot of brave medical people who are going above and beyond the call of duty. So I guess we can think about how we might want to honor those people at some point, but we should certainly brag on them today.
Zoom has revolutionized the way teams communicate.
Absolutely. I see Melanie Scott is on here, so we're going to transition. Hi, Melanie. Melanie is our Kiwanis chaplain, and I'm going to ask that she go through the invocation for us, please.
Absolutely. Thank you, Mike. Thank you, George, for giving this awesome update on some of our members who we need to keep in our thoughts and prayers. First off, our good friend Geff and his wife Jade, let's keep them in our thoughts and prayers. Their son Blaze is a newborn at Vanderbilt Children's Hospital and has had 2 heart surgeries now, and is, I think, slowly recovering. So let's keep them in our prayers. Miss Lois Holt is recovering gradually at home with the support of Ed. Steve Ho is still bothered by complications from a spinal surgery, but they are home now. Let's keep Joe White's parents, Rosemary and Raymond, in our thoughts and prayers as they're okay in spite of the fact that several residents of their assisted living facility in Chicago have tested positive for COVID-19. Naturally, they are concerned. And then let's keep Diana Chambers, her mother, who has dementia. Let's keep her in our thoughts and prayers. And for Jean and Bob Dudley Smith, report that they're hanging in there, but his mobility is a real challenge, but he is remaining in high spirits. Today, I came across this conversation with God, and I thought it was pretty perfect for what we're all dealing with right now. So, me to God. Okay, here's the thing. I'm scared. I'm trying not to be, but I am. God says, I know. You want to talk about it? I say, no. Or do we need to? I mean, you already know. And God said, well, let's talk about it anyway. We've done this before. I say, I know. I feel like I should be bigger or stronger or something by now. And God says, well, and he's waiting, unhurried, undistracted, and never annoyed. I say, okay, so I'm afraid. I'll do everything I can to protect my family, and it won't be enough. I'm afraid of someone I love dying. I'm afraid the world won't go back to what it was before, and I'm afraid my life is always going to be a little bit unsettled. God says, anything else? And I say, everything else. And God says, remember how your son woke up the other night and came running down the hall to your bedroom? And I say, yes. He says, you were still awake, so when you heard him running, you started calling out to him before he even got to you. Do you remember that? Do you remember what you called out to him? And I said, yes. I said, you're okay, you're okay, you're okay, I'm here. God says, why did you call to him? Why didn't you just wait for him to get to your room? And I say, because I wanted him to know that I was awake and I heard him and he didn't have to be afraid. God said, exactly. I hear you, my child. I hear your thoughts racing like feet down the dark hallway. There's another side to all of this, and I'm already there. I've seen the end of it. And I want you to know right here, as you walk through all of it, you're okay. I haven't gone to sleep, and I won't. And then I say, can we sit together a while? Can we just sit here a minute before I go back to facing all of it? And God says, there's nothing more I'd love to do.
Beautiful. Thank you for that, Melanie.
Sure.
It's tough to transition from that, but we're going to do it. And what I'd like to do now is offer two announcements. One, we're going to start with Taylor Fisher. We've got a really, really exciting announcement with regards to the Community Relief Committee. So Taylor, I'm going to turn it over to you.
Oh boy, got a lot of. So I have a lot of info for everybody. So over the last week or so, Mike kind of reached out with some people about starting a community relief committee. This originally started, the idea spurned from the tornado and has since grown since then. So we have a committee put together of 14 different Kiwanians. So I just wanted to take a second to recognize all those people. So myself and Lillian Beretta, we are the co-chairs of the group. And then additional members are Carlton Bolejak, John Kniss, Mary Enkema, Chris Tasic, Daniel Williams, Jeremy Enders, Royce Williams, Chris Greer, Steve Campbell, Lauren Cannon, Dave Haskell, and Bud Walters. So this is a group of 14 of us that is, we feel we need to obviously use Kiwanis to help as many people in need through this trying time. So kind of what our goal is to ultimately to use funds to help people. So we've split this committee up into 3 different groups. So myself and Chris Tasic, since we are both on the board of the foundation, we are the financial committee, and we will be in charge of making sure that once we select people to receive funds or needs or anything like that, we'll make sure the money gets to those folks in need. And then we're going to have I'm forgetting the term now, where I'm scrolling through my email, an engagement committee. Or just to inform all the Kiwanians of what we're doing and solicit feedback, and then a due diligence committee to just evaluate needs around the committee and what we can do as an organization to help those folks. So those are going to be 2 6-members. So really what I would encourage on the foundation side of things, we have committed up to $5,000, matching $5,000 to help put towards these efforts. But what I would really encourage everyone in the group to do is we'd love to hear feedback from everyone. We know there's so many people in need and good causes and things that we need to do, that we can help with. So I'd really love to hear from people after the meeting, email, call, text, however possible, of where we can start directing some funds to help folks in need. And then if you are so inclined, I know some people are better off than others, other people are paycheck to paycheck, of course, but if you feel so inclined, we are welcoming donations to help kind of grow the pot of money to be distributed throughout Nashville and help as many people as possible. If you are so inclined to donate, on the newsletter, there is the mailing address for where checks can go to, or you can reach out to Gwen Cole and she can help solicit any donations. Anyone who is interested, the committee or otherwise, we will be staying on the call after the meeting is over to just kind of get everyone on the same page and hear any initial thoughts of where we can start directing our focus.
Wonderful. Thank you, Taylor. So guys, this is probably one of the most exciting things that we get to do during this time of uncertainty. You know, we as a civic club are already at a very distinct advantage in that we have nearly 200 members. We have defined our mission. We have a foundation that can receive tax-deductible donations. Then, because we are able to quickly mobilize, we can put our collective effort towards making a positive impact in our community. And so I would encourage everyone to think how you can contribute. And it might be providing us with information about a nonprofit or an individual or family that we can find ways to support, or as Taylor mentioned, you can donate. I know a lot of our members, or perhaps some of our members, may be receiving checks in the coming weeks as part of the stimulus package. If you feel inclined and are able, that might be part of what you give to the foundation as a tax deduction. Second announcement before we get to Dr. Ming Wang is going to come from Melanie Scott with regards to PCAT.
Thank you, Mike. Just piggybacking off what you were just saying, a lot of the families, well, 100% of the families that we serve are living at or below the poverty line. So many have lost their jobs. So our staff who typically go into the homes to serve the families are no longer able to do that. So they're doing everything that they can to virtually visit with families. But a lot of the families that we're serving, especially living in remote areas of Tennessee, don't have Wi-Fi, and they do have government phones that they've been given, but they have such a limited amount of minutes on them each month. So we're trying not to use all of those so that they can still communicate with doctors and have other appointments as well. So we have developed an Adopt a Family page on our website. And Taylor, I can send that to you, or Mary, or whomever in the group, Chris, everybody. There's so many. It's so awesome to see so many people jumping on board, ready to help. But that's just one example of families that we're serving right now. What we're trying to do is scour the internet to find supplies for the families and then shipping them straight to their door, where we would be bringing them supplies on our visits. Since we're unable to do that now, some of our staff are incredible and are staying up till all hours just trying to find diapers and wipes and food items and baby formula, all the things that we can do to try to keep the baby safe. And we're also trying to pump out a ton of information through our social media that is just trying to support parents during this stressful time.
Wonderful.
Thank you.
Thank you, Melanie. Obviously, this is one example that we can give this information to the Community Relief Committee, specifically the due diligence team, and it becomes part of a list. You know, we're going to prioritize where within our community are the needs and where can we have the biggest, most positive impact. Now, I'm going to turn it over to Kenny Marcanic to introduce someone who is no stranger to our club. He is the recipient of one of our most prestigious annual awards, Nashvilleian of the Year Award. We're most grateful for everything he does in the community, most excited about him being with us today. So Kenny, if you would do the honors, please introduce our special guest today, Dr. Ming Wang.
Thank you, Mike. If you can't read the bottom line on Ming's tie, then you need to contact Alana for an appointment in the next week or two. As Mike just said, Dr.
And we can do virtual surgeries.
As Mike said, it reminded us Dr. Wang was our club's 2015 Outstanding Nashvilleian of the Year for all of his contributions to our Nashville community. He's also the director of Wang Vision 3D Cataract and Laser Center, which is a world-renowned laser eye surgeon, and he's also a huge philanthropist. All his friends and colleagues know that. He's currently working with colleagues from around the U.S. and the entire planet in China, Japan, South Korea, and Italy to discuss COVID-19. Together, they're building a message to provide guidance on the current situation around the world, the nature of the virus, its treatments, and insights onto how to avoid it to stay healthy. Dr. Wang has been a leader in the Nashville business community, a patriotic citizen, and he's a bridge builder, bar none, to bring people together. There are few like him that have this unique capability to speak to our club on this subject. In addition, it's now his life's calling to helping people find common ground and solutions to problems in our society, specifically in healthcare, jobs, and the economy. He recently submitted an article to the Tennessean about this, detailing how the coronavirus outbreak has revealed how critical it is for all of us to find common ground today's polarized world, and he will be speaking about that to us today. Please join me in welcoming a great friend of our club, Dr. Ming Wang.
Thank you. Thank you, Kenny. And it's a pleasure to be with you all again today. This is an honor to be with the Kiwanis Club. And I want to thank Kenny for the invitation to the club for the honor to 2015, the Nashvillian of the Year. And also, I want to remind everybody to keep Kenny's wife, Jennifer, in our prayers as she's fighting successfully with God's blessing, her medical condition. And if you look at this, what I like to do is divide this presentation into two parts. One is I want to go through some of the most important questions. And second, I want to leave plenty of time for everybody to ask questions. All of my information will come from my colleagues from around the world, from China, South Korea, Japan, Italy, and around the United States. From WHO recommendations and on research and publications, which are rapidly coming out regarding this virus. And as Kenny mentioned, I'm a practicing ophthalmologist, taking care of patients with eye problems, including eye infections. And 1% of the viral patient has the virus in their tears. And today, when we're faced with a situation like this, I've been thinking, what is the most important need for us as average citizens? You know, there's so much information. So today, I'd like to give a brief presentation to focus on 10 questions that give us, most importantly, what each of us need to know as an average citizen. So I'm going to distill, extract information from all this information right now out there and summarize for all of us what is the most important information for us, our loved ones, families, and colleagues. So 10 questions I want to address today are, number one, what's the situation right now? Where are we as a nation? Second, why this virus is so deadly? Third, why this virus are killing young and healthy patients? Why? Number four, what are the two main modes of transmissions we need to be aware? Number five, what are the eye conditions associated with this viral infection? Number six, what country has done the best? Why? Number seven, what country has done the worst? Why? Number eight, what's the benefit of staying home? Number nine, how can I keep myself from being infected? And finally, what are the most important two things that each of us need to do right now? So let me go through each of these 10 questions, then open up for Q&A. First, what is the situation right now worldwide, and where are we as a nation? We are about 4 to 6 weeks behind China, 2 to 3 weeks behind Italy. China has coming down on the curve now. Italy's at a peak. So by all estimate, we're looking at United States peak at about mid to a little bit later than mid-April. United States today has almost 250,000 infected and over 6,000 deaths. Tennessee has over 3,000 infected and nearly 40 deaths. And we're ranked the number 14 or 15 right now on the list of the states most infected. So New York right now is our Wuhan, China. So that's where we are. Second question is, why this virus is so deadly? Because most of viruses, medically speaking, are either very infectious, like common cold viruses, but not very deadly. Cold does not typically kill us. Or some viruses that are not as infectious, but very deadly, such as SARS about 12 years ago. But COVID-19 is unique. It is extremely infectious. It's one of the most infectious viruses ever discovered by medicine today. But also, it's quite deadly. Not the most deadly, such as SARS, but is ranked there, up there. So it's this lethal combination, very rare lethal combination of both very, very, very infectious and quite deadly that makes this virus so deadly. Most of the viruses, either one way or the other, but this virus is both. Number 3, one of the most common questions I get these days, because we're involved in the front line of taking care of patients, taking care of emergency patients, and I'm in daily, hourly communication with my colleagues worldwide, and trying to figure out why, among many questions, one is why this virus is killing so many young people. You know, yes, it does kill majority older folks or people with underlying medical problems, immunodeficiency or diabetes or medical conditions, high blood pressure, other things. But this virus is killing lots of young people, healthy, no immune problem, no underlying medical cause. In Italy, 44% of the deaths are patients under age 45. Why? The medical answer is becoming clear now as the virus been progressing. The scientists from around the world, finally, we began to realize that the crucial concept is viral load. Viral load, or the number of virus that you inhale initially. If the viral load is small, the number of virus that gets into your system initially is very small, such as distant exposure, single contact. Then, because the virus that gets into your lung is so small in number, viral load is small, and the virus does take time to replicate. So while it's replicating from, say, 1 or 2 viruses, it takes a while, days. That's why the incubation period of this virus is about a week or 2. So in 98% of us, 98%, that the viral load is very small. Our immune system has the time to gradually ramp up the immune response to produce the antibodies to kill it. That's why in 98% of the patients who are infected, you know, the immune system has the time to respond. They are small dose, virus dose infections, casual contact, single exposure. However, if a patient has large amount of virus that gets in the system to begin with, a large viral load, such as repeated exposure, close proximity, or someone literally sneeze or cough at you who is infected, then the number of virus that gets into the system initially is very large viral load. And since viruses do replicate in a very short period of time, it quickly overwhelms your system. Then your immune system's duty is to save your life. So immune system quickly respond. It has no choice but to not only quickly respond, but respond with the highest level of response, highest alarm level. Recruit all the immune cells from your body to the site of infection. Such rapid, large recruitment of immune cells in a very short period of time is what we call cytokine storm. CYTO, cytokine, CYTOKINE. Cytokine storm is particularly bad for someone who is actually healthy and young, no immune problem. In fact, the single most important and most frequent factor to kill these young COVID-19 patients is not the virus, but the immune overreaction due to initial large viral load. Immune system have to ramp up so quickly and so powerfully, and their immune system, the healthy immune system of young people, work against them. Actually, the immune overreaction, cytokine storm, is what kills all the young people. This is very evident. All the young doctors and nurses from around the world, 30 years old, 35 years old, are dying from the virus. It's the immune system killing them due to large viral load. Next question is, what are the two means of transmission, COVID-19? Surface and air. Surface. This virus figured out two very rare, unique ability. That's why it's the most infectious virus that we ever have encountered as humankind in long eons time. Number one, this virus figured out a way to co-travel with bacteria. So any surface that you think is not clean, and that may have bacteria, that surface has COVID-19. This is very unusual. This virus figured this the way out. So any surfaces. So it hang on surfaces, different surface, different amount of time. And some copper surface, metal surface shorter, few hours, all the way to plastics, 3 days. Second mode of transmission is air. This virus also has a very unique ability to suspend itself in the aerosol for 8 hours. Then you say, Dr. Wang, what's aerosol? Is it air? No, it's not air, it's aerosol, meaning small suspended particles in air. To get a sense of aerosol is that if you walk into, you have some Indian friends that, for example, you walk into their house, they're cooking, curry, they could stop cooking 24 hours ago. And 24 hours later, you walk in, you can still smell the curry. That's aerosol. Aerosol suspended in air for a long time. Because this virus found itself suspend with the aerosol, so it's suspending air for as long as 8 hours. So that means what? That means you can walk into a space in the previous 8 hours, breathed by someone who's infected. The virus will suspend itself in the air for the 8 hours, and then you walk into that space in the next 8 hours. You can inhale the virus. That's why one of the biggest outbreak was in South Korea and western part of the United States. Like large number of church attendees after one Sunday service got infected. It's in the air. Number 6 question is, what country has done the best? South Korea. South Korea is the envy of the world. It has effectively controlled the infection and death rate extremely low. Why? Principally, 2 reasons. One is the South Korean leadership got together quickly, resolved their differences, and implement medical measures quickly without delay. It's the first few weeks that matters. Social distancing, stay home, quarantine, and wear masks. Wear masks. There's a major issue for Western country. We have a cultural stigma against mask wearing. But in Far East Asia, China, South Korea, Japan, no problem. And so government get together quickly, overcome their differences rather than polarizing themselves. And second, testing, testing, testing. Because you got to test quickly. It's like a fight in a war. You have to know where your enemies are, the viruses. If you don't test, you don't even know. It's like fighting with blindfold. You cannot fight without testing. South Korea nearly tested everyone. And they use new technology, also use digital tracing. So they take cell phone of someone who is infected and digital tracing whoever he or she has been around in the last 2 weeks and quarantine all the people. New technology application. So these are 2 reasons that South Korea. What country has done the worst? Number 7, Italy. Italy has the highest infection rate and highest death rate, nearly 10%. Horrible. Why? 2 reasons again. When the outbreak started in Italy, in contrast to South Korea, Italian leadership was quarreling, debating because they're polarized. They couldn't come up with a consensus quickly within the first crucial few weeks of the infection. And for weeks into the infection, the restaurants were still open and public transit still. In fact, Kenny mentioned early that I just submitted an article to Tennessean, hopefully it will be published soon, this week, next week, that it has to do with polarization, how damaging polarization is to our society today. That it is the ability to overcome the difference. You know, if we are not habitually trained to overcome our differences, whatever the differences, political, ideological, in a society, when crises come, we're not used to talk to each other, overcome the differences, because we got in the bad habit of polarization. Polarization stagnates at this society and is the coming together that move the society forward. So Italy suffered from that. They were not in the habit of common ground funding, and they missed their crucial first few weeks. Incidentally, also, Kenny mentioned that I'm forming a nonprofit organization called the Common Ground Network. That is the mission is to bring people together in a society to solve the problems of our society. Only through finding common ground can we find solutions. And the other thing is lack of mask wearing in Italy and the lack of testing. So it's almost the opposite of South Korea. Number 8, what's the benefit of staying home? Lots of people say, well, why? 2 benefits. 1, we can avoid crashing our healthcare system if we have too many people got sick too quickly. 2nd, we will peak mid to late April in the United States. That staying home will flatten the curve or reduce the height of that peak. Otherwise, we are running towards 100 to 200,000 deaths in the United States. How did that number come about? You just take New York, replicate times 50. Number 9, how can I keep myself from infected? 3 things. 1 is cell phones. Cell phone is something that we touch every single moment in our lives. You may think you touch some surface and wash your hand, but guess what? Last time you touched your cell phone. Then you may wash your hand just now, but you touch your cell phone when you touched 5 minutes ago with a dirty hand. So the virus hangs on the surface for as long as 3 days. So what do I recommend? Carry a little stack of alcohol pad or something. Wipe your cell phone constantly throughout the day if you're out. 2nd, gas pumps. If there's one place where everybody touches in a society, it's the gas pump handles. So what I recommend is bring a roll of paper towel in your car. When go to gas pump, the stations, wrap around the handle with the paper towel and use the handle to touch the buttons, and then throw away the handle before you step back into your car. And lastly is the hot water. The virus is inactivated in hot temperature over 77 Fahrenheit. So drink hot water and wash your hand with soap with hot water. In 1918, the Spanish flu, the only way they found effective in dealing with Spanish flu, in which 60 million people died. 1 in every 4, 100 years ago, died from Spanish flu. But at that outbreak, the only way they found to be effective is sunbathing. So they put all the hospital beds out in the sun because virus is afraid of light and the virus is afraid of high temperature. Finally, what are the 2 most important things we need to do? Stay home, as I said, flatten the curve. And when you go out, wear masks. CDC recommends that if you do have flu symptoms, you have to wear masks. But part of that reason is honestly is because they don't want people to go out and stockpiling masks. So we run shortages, so healthcare workers don't get to have them. But mask is very important. 2 benefits. It doesn't prevent all the viruses. It does prevent some, inhaling, exhaling. But second benefit of mask wearing is something that people don't realize. If you wear mask out there, you don't touch your face with your dirty fingers. Because our fingers are the most dirty. It touches the most things in a day when you're out. So the mask, the second benefit people don't realize, if you wear mask, you actually prevent your dirty finger touching your face or nose all the time. So stay home, wear masks. So in summary, I have answered these questions, 10 questions. And to summarize, These 10 questions are, number one is, where are we as a nation? We are peaking mid to late April. We're 250,000 infected, over 6,000 deaths. Second, why this virus is so deadly? Is because it is very infectious and also very deadly. Not as deadly as some of the other viruses, but it's quite deadly. So this rare lethal combination. Why virus kills so many young people? It's because the large dose of virus gets into the system, so short period of time, close proximity, repeat exposures, such as healthcare workers, young healthcare workers, and their own young, healthy immune system work against them. That's what killed them. The overreaction of the immune system called cytokine storm. What are the two modes of transmission surfaces? And air suspension as long as 8 hours. What are infections associated with virus? Essentially conjunctivitis or pink eyes. What country has done the best? South Korea. Why? Government got together, overcome the polarization, found the common ground, and testing. What country had done the worst? Italy. That's the opposite. They did not have a habit of finding common ground in a normal peacetime, so to speak. So when the crisis come, they did not know how to find the common ground, keep on arguing, resulting in a delayed implementation in the first crucial few weeks. And also lack of testing. What's the benefit of staying home? To avoid crashing our healthcare system right now, and also to reduce the height of the curve, flatten the curve. So when we do peak in mid to late April, we're not as high. Hopefully not something like 100, 200,000 deaths as the administration is predicting. How can I keep myself infected? Cell phones, alcohol wipes, gas pump handles, paper towels, and hot water drinking, hot water hand washing, and sunbathing. That's good. Finally, what are two most important things we need to do? Stay home and wear masks. CDC recommend if you have flu symptoms, you have to wear masks. That's in part because we're afraid of running out of masks. But in all these other countries, people universally wear masks. Even though masks do not block all the viruses, only partially. That's true. But the second benefit that most people don't understand is it protect your face from the touching of your dirty fingers throughout the day. That you're not aware, you accidentally touch your nose, then you can breathe in the virus. So it's that insulating your face from your own hands. That's actually the main benefit of wearing masks.
Ming,
So anybody has question can ask me, but here's the Q&A.
Yeah, Ming, couple of things. Number one, thanks for explaining how it affects some people so dramatically and others. We had somebody in our office, as I told you the other day, not in our office, but he works for us remote. He and his cousin and his sister and his niece all got the virus, and all of them were basically down for a day with a fever for one day, and they stayed in bed for another, and they came back and they felt fine in 2 days. And you hear that, and then you hear how many people died, and you go, wow, is it even the same virus? But you explained well why some people get it and are overwhelmed by it, and other people are not. Number two, if staying in the sun and heat kills it, then why are they having such a bad issue in Florida where it's hot?
Very good question. As I mentioned, 77 Fahrenheit is the temperature above which virus began to be inactivated. The virus is a fatty coat with those projections with the protein receptors. Inside it is the DNA or RNA tangled with protein. And these proteins get inactivated in high temperatures. However, it's not a complete inactivation. It's about partial inactivation. And so even not just in Florida, in tropical areas of the world. In fact, the second major wave of this virus will come in the third world countries, in the developing countries on the the equator area of the earth. And there, even the temperature is higher, but because it's not complete killing and they're coupled with much poorer healthcare system, we're gonna see a second wave of very bad infection in those areas. So it's only a partial inactivation.
Okay.
Dr. Wang, in the 12 to 18 months until we have a vaccine, do you think that variolation would be a useful tactic? And if so, why aren't we really hearing anything about it?
Variolation?
So taking a small dose of the actual virus and infecting it with people like they did for smallpox?
Yeah. I see. No, it's not recommended. In fact, Great Britain initially came up with a similar thinking, is that since all of us may be infected anyway, and might just well, like everybody get hug each other and kiss each other quickly, so you get all everybody infected, acquire group immunity. That quickly got reversed and by WHO and other CDC because this virus is so infectious and that this large viral load is such a critical determining factor in causing death. We're going to have 1 in every 4, 1 in every 3 people die if we let it go like that. So in terms of taking sample virus to give to people, we have no ability to control the amount. So as you know, so that's not recommended. Now, in the viral vaccine production, right now I have good news to tell you. Right now, they're actually testing in human beings already. I have some colleagues just send me some photos. One photo is of a gentleman who is, we're all grateful to people like that, that is actually a volunteer. So he got the virus, the vaccine sample, and they're monitoring him. Research, I'm very many friends involved in actually researching that. And so the vaccine already passed the animal stage, meaning attenuate the virus, change the virus to remove the virulent part, but retain the immunogenic part, the part that causes immunoreaction part, keep that, put it into mice, and mice survives. And then now they're actually in human. However, it's going to take at least a year and a half, because this virus has mutated 8 to 10 times already in the last 2 months. The strain that affected Italy is a little bit more virulent actually in the United States. Percent of death in the United States still low compared to Italy. So it's so many times mutations already. So more mutation virus has, the harder to generate a vaccine against that because vaccine is to elicit your own immune response. So you really have to have several different vaccines. SARS 12, 15 years ago took us about a year to produce the vaccine. So we anticipate vaccine will be at the earliest available in early 2021. So the hope is we keep everybody else not infected, 99.9% patients or all of us not infected right now. And then 2021, when vaccine available, everybody get vaccinated. And final point is that when the viral peak subsides in May or June, our life will be fundamentally different. We are going to have to maintain social distancing to quite a degree, wear masks and all these things, all the way until the vaccines become available next year. So our life as we know it will be completely different.
Ming, it's George Armistead. Thanks for your comments. Good. I have noticed, I've been spinning through the different pictures of the 77 participants today. And I noticed that as I was spinning through, only 3 of us did not touch their face. And it's amazing. I put this mask on after I heard you say that, and you will not come close to touching your face if you have a mask on. So more than anything else today, other than being wise and taking your advice to heart, is the fact if you have a mask on, you are not going to touch your face. You're not.
That's right.
So yes. Thanks.
And Chris, so with the vaccine you were talking about, I've seen all different stories almost daily in the news now. University of Pittsburgh had something out today that they're working on, a fingertip vaccine and other treatments. Is it just sort of a race to whoever's there first, or is there differences in these things? Vandy got $1 million grant from Dolly Parton to develop something. Are these all being coordinated efforts, or are these independent efforts? Where are we at realistically on getting treatment and vaccine, in your opinion?
Yeah. The vaccine eventually will come out most likely in the injection form, such as the common flu vaccine we get in the fall to be ready for the cold time, winter. As I said, virus is most active in the cold temperature and inactivate at least partially in the warm temperature. And so it's going to be probably injection. In terms of coordination, overall United States is pretty well coordinated within United States. And one of the things is, it's almost like World War II. When we got our country, US involved, you know what? The tide is turned, right? In World War II, because we have the biggest industry, the most powerful industry, and the most amount of money and everything. So US research machinery is finally turned on. It's going to be more powerful than any other country. So there's a little bit silver lining in this tragedy so far, that we at least initiated the world's most powerful research machine with Bill Gates Foundation and others. And the coordination between countries are limited. For example, there's a concern about a lack of communication or data sharing between, say, China and the United States. And I think there's my common ground, thinking is, this is the time. Let's put up aside our differences. Let's share our scientific data. China has the longest time. China has the patient zero, right? And let's share these data, because that's going to be critically important as producing a vaccine to save all of us. At a time of crisis, we realize we're all vulnerable as human beings, and we all have to find a way to work together to survive. So international cooperation is very limited, but hopefully will be more.
Thank you.
Hi. Hey, Dr. Wang.
Yes.
Oh, I'm sorry. I'm sorry. I was going to ask Dr. Wang, as far as like picking up groceries, do you recommend maybe on what my wife and I have been doing? We have a table on our front porch, so we bring in the groceries that we picked up, curbside at Walmart or wherever, and then we take them out of the bags and we wipe them. We wipe every piece down, and the ones that can stay out there, we'll actually leave them out there for a couple of days. Do you recommend that, or is that overkill?
I do recommend that. That is what the most successful nations, such as China, Wuhan, for example, reopened for business now, but everybody's still wearing masks. In South Korea too. And so my recommendation is, you go to grocery shopping, right? Right. Wear the mask, so you don't touch your dirty finger to your face during shopping. You got home, right? And then you wash your hand 20 seconds with soap and hot water. And then you take the grocery shopping, it's covered with plastic bag. You can wipe them down. Some people put alcohol, put in a spray bottle, spray it, and it's just air dry, okay? Or you can wipe it down with alcohol pad. That's also. And basically, you have to wipe down all external surfaces. And not only just shopping. If you have UPS delivery of a box or something, you can't just bring in the home. You have to, while you're outside, wipe it down. Or the other thing, you do not want to dust. You can't just go to home and take off your overcoat, shake, 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 rub. No, you're just dusting the virus into the air. Remember, it can stay in the air for 8 hours. So what do? Never dust. Don't use feather dusters. Put it down, and using a cloth with hot water, wipe down the surface of your jacket or something. So for shopping, yes.
Thank you.
Dr. Wang, my understanding is that there's an antibody test that's released sometime towards the end of this week or next, I guess. What is the most effective way to obtain the antibody test, and how will that help us?
Yes. There are two main strains of testing at the moment in terms of mechanism of testing. The one that has been popularized, used the most often, is a DNA polymerase chain reaction testing. Okay, so polymerase chain reaction, or PCR, it's the mechanism of testing. You take a swab of the throat, and then you get a little viral piece. You break it down, you can actually detect viral DNA as such. The problem with that testing is it takes a little bit of time, sometimes a day or 2 or 3 or longer. And also it has lots of false negative, meaning if you take the part of your throat, just happen to have an area, no virus, then you're not going to detect that. And also, it does not tell you whether the person is reacting to it. Just because you have virus, as Kenny mentioned, and 98% of us, we don't have a problem, no big problem, so that we quickly kill the virus, so you cannot detect the virus. So the most important, actually, in terms of assessing whether the person is actually materially affect that person, is the antibody testing. That is, you detect the reaction of the person, because that, if you found antibody, there's a for sure, there's no false negative at all. It's for sure the person is infected, because that's the only way he or she can mount antibody testing. It's much faster, and so I look at the future as a combination of the two. Now, in terms of the swab, I want to tell you why it's false negative. This virus stays in our throat for about a few days. And that's why it has this phenomenon that you got infected and for a few days, no problem. And you only recall your exposure was 3 days ago. So if you drink lots of hot water, you wash down this virus on your throat, not into the trachea, but into your stomach, esophagus. So that's why hot water drinking is good. That's why some early symptoms are dry cough, when the virus still hang around the throat, not going to the trachea yet.
I have a question. Oh, you could go.
Hannah, thank you so much for that explanation. I think I'm a little bit loud. I just wanted to ask one thing real quick regarding the deadliness of the virus. So the infectiousness is pretty obvious, but the lethality, so the numbers that I researched, the Italian government released official numbers that I think right now are a bit over 10,000 deaths from the coronavirus. And based on the CDC's numbers, we had, if I remember correctly, 61,099 deaths from the flu in 2018. So Italy has a population of 50 million people. We have a population of 300 million people. And Werner Riccardi, the scientific advisor to the Italian government, said that the way Italy tests is basically they do a test for coronavirus for every person, or on every person who dies in an Italian hospital. So regardless what the cause of death might be, if they test positive for coronavirus, so let's say somebody who had 2 prior heart attacks and has been in life support for 6 months, if they test positive for coronavirus, that person is counted as a coronavirus death. So the National Institute of Health estimates that a maximum of 12% of these cases actually died as a result of the coronavirus infection, and about 88% died of other causes, but got infected with the coronavirus. So I extrapolated those numbers to basically multiplied them with 6 to get the per capita equivalent in the United States, to see basically where we're heading. And I got to, based on 12%, I got to, I think, 43,000 roughly. So assuming that Italy is somewhere at the peak or just past the peak, we would have to expect those numbers to double, which would bring the caseload, if everything was the same here as it is in Italy, to roughly twice that number. So we would be looking at 80-something thousand deaths in the United States. Now, not talking about the symptoms. I obviously don't wish on anybody to die from pneumonia or to end up in a hospital. But just looking at the lethality, that does not seem all that much more deadly than what we had with the flu in 2018 to me. But I'd be curious to hear your view on that.
Yeah, excellent question, Toby. Right, I can tell from your voice. Yeah, there are 2 questions you're addressing. So in regarding infectious with deadliness, as I said, most of the viruses, one way or the other, it's like seesaw. Very infectious, not deadly. Very deadly, not infectious. And so the very infectious, not very deadly is common flu, and very not very infectious but very deadly is SARS. So if you think of 0 to 100% scale, this virus is infectiousness off the scale. And the deadliness is not the most deadly, but somewhere quite deadly. I would say 50, 60%. Italy has, as you just confirmed, it's about 10%. 10%, the deadly rate is usually measured in the virology somewhere, anything above 5% or 10% is considered to be very deadly. But there are viruses, 30, 40% death, but that's a swine flu and others. But what I'm trying to say is this is a very, very infectious, but quite deadly, but not, off the chart deadliness, yes. Now, that's the first answer. And second question has to do with what's happening in Italy. Italy has a very mutated, as I said earlier, the virus has already 8 to 10 mutations in the last 2 months. So Italy happens to have a very mutated, very virulent strain. And so I think my feeling is our prediction right now of 100 to 200,000, I really hope and I also believe is likely to be overestimate. And I think it's a part of our leadership intention to really hit the point. Stay home, okay? That's almost the worst scenario. Using that to, there's no other way to make people stay home. People in Florida stay high on the beaches. So I think 100 to 200,000 deaths in the United States is an overestimate. It probably will end up to be probably somewhere around, 50,000. And we are about 6,000 deaths already. So another 10 times probably the extent of it. And the other thing has a lot to do with, are we able to replicate the amazing feat that China has done, which is basically locked up Wuhan, and the rest of the country is fine and relatively fine. But we, in the United States, we can't lock up New York. So that's the problem. And, China, amazing, such a big country, only has like 4,000 deaths. Just amazing. There's such small country, 6 million, Italy has 10,000 deaths.
If you believe the official Chinese numbers.
Yeah, there's some water there, it's obvious, but you have to say overall, it's really achieved amazing, but even better than China is South Korea, as mentioned, in terms of suppressing but because they got together quickly and testing.
So Dr. Wang, it's Elaine Kay. How are you?
Hi, Elaine.
I've really enjoyed this. Our daughter is in New York, working at Sloan Kettering, so she's right in the epicenter. She's not seeing corona patients, but seeing kids with cancer. Most, or I should say a lot of her friends in New York they've either left and are doing self-quarantine or they have the virus. And none of them have actually been tested because they've been told to stay home, don't get out. And so with that thought, what is your opinion on all these numbers and everything that Toby was coming up with and everything? While they're interesting, can we trust the numbers, whether out of China or I know we can't trust the ones out of New York, and a lot of them still aren't even back from Nashville. It's taking, I've got a girlfriend who's on day 9 who was tested and still doesn't know. It turned into pneumonia, but so she's thinking she might have had it, but no test is back yet. So that's my question, is what these numbers can you even have?
Yeah. China number, I cannot comment because I think it's not as reliable as United States numbers. And in the United States, right now, we are hovering around 1.5% death. In reality, I think it's probably more like 0.5. And because I think we have a strain of this virus, less virulent strain compared with Italy. Italy has 10% death. Right now it's 1.5 because the number of people who have not been tested, in my opinion, several times bigger than the people who have been tested in the United States. That's why testing. We got to push. I think the recommendation at the moment is that anybody who has symptoms, in early on, because United States were behind in testing, which is really, really, really bad, that the CDC has its own kits. It didn't work for several weeks, crucial first few weeks. So we missed that crucial window that China and South Korea has worked so hard to earn for the rest of the world, delay a few weeks, and we didn't take advantage of that. And so we still don't have a widespread test available in an instantaneous basis, which is necessary. So initially, our United States testing, you have to overcome hoops in order to get tested. You have to have all kinds of symptoms, and the fever has to have positive identification of prior contact. Now the criteria is lowering now. Fortunately, more people get tested. So as more testing go on in the next week or two, we're going to see a ballooning of the infected, going from a 250,000 to a 500,000 easily. But doesn't mean that they just got infected in the next 2 weeks. It just means they're walking around in the population. They are already infected. It's just not being tested. So the standard recommendation is stay home. But if you have any symptoms, which are a dry cough, fever, malaise, and taste change. Taste change is very pathognomonic, very unique for this virus. Then go get tested. Because once you test it, it's not just staying home, it's quarantine. That means you lock up in the basement, you cannot in touch with any other family members.
Where do you think US is in the level of South Korea being the best at this and Italy being the worst? Are we like, it seems like we were closer to Italy, but maybe now we're getting smart, but it's a little late.
Yeah, we actually, unfortunately, we are closer to Italy than to South Korea. And principally because the exact two reasons that make, that make South Korea more successful, Italy more less successful, is the initial first few weeks when, late February, United States should have been testing right now because we have weeks to get test kits ready, right? I mean, since January, there's no excuse why early March we didn't have enough testing kits. Yes, you don't want to cause the disturbances to the public in late January in the United States. I agree, but you can make testing kits, silently, so to speak. So that's a big blunder by CDC, and the kit didn't even work in the first few batches. So that is the same with Italy and different from South Korea. And second is the polarization. Polarization. I mean, what's more important at this time? Is the political things more important or the well-being of the nation? I mean, the fact that we still are pouring about political things and all these, I mean, it just shows that we are so polarized as a nation that not only we need to get together quickly to solve the crisis, but in the peacetime, we should learn how to find a common ground to begin with, better trained, so that when crisis comes, we can deal with crisis quickly, not like Italy, but like South Korea more. And even in peacetime, normal time, we should be less polarized, that we can get together to find a common ground and solution to society problem anyway.
Thank you.
Dr. Ming, I really appreciate, and echoing what other members and guests have said, all the information you have shared. I want to be respectful of your time. Typically we've been very punctual, ending right at 1. These are certainly extenuating circumstances, and you're providing some really, really useful, actionable information. If we have additional time, Kenny had pointed out to me, or perhaps Pete McNamara, that during the course of your talk, we've had people asking questions in the chat feature. So first, let me ask, how much time do you have, Dr. Wang? I know you're extremely busy.
Oh, right now I blocked 2 hours, so I have time.
Okay. Well, we certainly appreciate that.
Yep, Mike, just housekeeping too. We have to end the call at 1:30 because this account there's another meeting that starts at 1:30.
Wonderful.
Using this account number, so my apologies for that.
No, it's perfect. 1:30 will be our hard stop. In the meantime, we'll try to address some of the questions in the chat feature. Let's see. I'm trying to find one here.
I have one.
Go ahead, Joe.
Dr. Ming Wang, thank you again for your comments today. I have a CPAP machine, and I have a SoClean that cleans my CPAP machine, using ozone. Can I put my mask in there and reuse a disposable mask over and over by cleaning it in there?
Very good question. The answer is generally yes. The mask can be reused, no problem, in general. And in your situation, no problem. And the recommendation, medical recommendation for mask cleaning is, let's say you go out, you only need to wear a mask when you go out, of course, unless you're quarantined at home, in contact with other things. But generally staying home, you don't have to worry. But when you go out, you come back, as Big George confirmed, the biggest benefit, once again, that's go out, tell all our friends after today and family member friends, the benefit of wearing masks is more so than prevent you touch your own face out in the public than blocking the virus. This is so important. Now, you get home, you take the mask off, you take an alcohol pad or depends on the type of mask, the texture, but alcohol pad or cloth with hot water, squeeze the water out, just wipe, and let it air dry overnight. You can use it next day. Generally speaking, not a problem.
Thank you. Good to know.
So Dr. Wang, coming from Pete McNamara, he asked the question, does raising the body's pH level help fight off the virus?
Yes, in the laboratory, but not in human body, because our human body is very neutral and fluctuated within very close to about pH 7 or 6.8 or so, generally speaking. And in fact, any significant deviation from acidity or basicity actually will kill us as a human being. We cannot live in any more acid base within a very tight range. So you can't drink, vinegar or something to help yourself. It doesn't work because it doesn't change your pH value of your body that much. So that's in the body. But in a chemical reagent, generally speaking, the acid does help, but you have to make a very strong acid or strong base to lyse the virus fat coat as such. So for practical speaking, what we drink, what we eat, it doesn't make that much difference.
Good to know. So one of our newer members, Graham Harlan, asked the question, and she, I'm sure, was thinking about this because she's in the hospitality industry. She asked, does the reduction of services from dine-in to takeout in restaurants actually help or perpetuate the issue? And she goes on to ask if other countries like South Korea imposed restrictions and if you think that was helpful.
I understand it's about restaurant, but I did not understand the question.
So the question was, if a state official, governor, mayor, suggested that restaurants should close entirely and not even offer, for example, a dine and dash option where people could place an order online or telephonically and then pick it up, perhaps even outside the restaurant. Is that a measure that would help reduce the spread of the virus? Or
that's a good question. The biggest risk of having restaurant open for live dining in is the social distancing, the touching, and the airborne suspending 8-hour virus tendency. Now, in most countries like South Korea, that in China, that if the restaurant can produce the food, and enclose it with plastic covering. In fact, the strict lockdown in Wuhan 2 months, that's how they did it. They delivered to the home, and they have to check the temperature of the deliverer, make sure that he or she, the carrier, is not infected, and then they pass the food, and because it's enclosed with the plastic wrapper, and then they just discard the outside wrapper. And inside the food, there's a bit of risk in case the chef is infected, of course, then it's difficult to say, there's a whole chain of food production. But that is the good general mode of prevention as such. That is, you can deliver the food, but enclosed in a plastic, and then you kind of take the inside out.
Thank you for that. So you are perhaps the ideal person to answer this question. Looks like it's coming from Alana in your office or on your team. She asked, what do you recommend when it comes to wearing contacts?
Yeah, American Academy of Ophthalmology has just sent out a document to all the ophthalmologists in the United States now, and optometrists, that because 1% of patients with COVID-19 has been found to have the virus in their tears, that after we now, as well as after we pass this, because our life will forever changed, it is now recommended that there's some risk of the passing the virus with the contact lens wear. And that's the way it is, and we never knew that before this virus outbreak. So generally speaking, that will be a recommendation against contact lens wearing in general, even after we pass this thing. Because remember, the virus is not gone until sometime 2021 when we develop vaccine. 99% of us will escape uninfected, and so all of us will still be vulnerable after this outbreak's finished all the time until 2021. There's no such thing as group immunity, only individual immunity as such. So that contact lens will be recommended as not as an ideal mode of vision correction. Glasses fine. Optical glasses are generally okay. Or some people want to have laser vision correction. That's of course another option. But contact lens will not be as recommended because of the experience of humankind with the virus now.
So I want to end with a positive question for Dr. Wang. Kenny, you go ahead.
Okay, I had one quick question along those lines. I was told by another doctor as well that in addition to a mask, one of the most important things you can do is to wear what he recommends is a pair of fake glasses. Now, we had some in our club for a while because we were all doing it as a joke years ago, and it did raise the IQ level of a few people. But other than looking smarter, he said that the particles have a way of getting into your eyes if somebody sneezes, and the best way to prevent that is to wear a pair of if you don't need glasses, or if you wear contacts, just wear a pair of clear glasses, and it'll block 90% of any airborne particles that might go in through your eyes.
Yes, currently the recommendation is that, as I said, CDC said you have to wear masks in the public if you have symptoms, but learning from other countries, everybody wear masks in the public. So currently it's to wear masks. You don't have to wear the shield on top of it unless you're an ophthalmologist like me. I'm actually physically have to look people's eyes, and most of my patients, cataract surgery are elderly, so they are more infected. And if they sneeze or cough directly at me, in that situation, with the shield is important. But generally, for most of us, don't have close contact with sick people, that's not needed. But I want to mention another thing. There's exciting research development about 2 days old that in China, a group of scientists has just invented a glasses. They can mount the device onto your glasses, and you can go out in the public. You see a Kiwanis meeting, 200 people. Within 0.5 seconds, you can tell among the 200 people who has high body temperature. This is an infrared detector mounted onto your glasses, and you can wear them. Any crowd you go in, you can quickly detect in this party who has high body temperature. And you just stay away from that person. It's amazing technology. It's going to really revolutionize how we behave in the public. This type of Google Glass type of infrared detection of people's body temperature. This just got invented in China 2 days ago.
Wow, that's exceptional. All right, in the spirit of being hopeful, and I realize that none of us have a crystal ball, and so we can't really answer this with any authority, but Dr. Wang, in your opinion, how do you think that we may take this period, which can only be categorized as a period of extreme suffering, and use that for human achievement and accomplishment?
I think the biggest lesson we've learned by watching how was a dramatic difference in terms of success or lack of success of different countries in dealing with this virus, successful in South Korea, unsuccessful in Italy, that after this passed, that we all will end up being able to learn a valuable lesson. That is the country that did not deal with this, Italy, and unfortunately the United States closer to Italy, as I answered Elaine's question early, that the principal reason is the polarization. that because we're so polarized as a society on normal times, no viruses, society is, social atmosphere is very toxic. The merit of issue is often not as important as other factors such as political power alliances or whatever, ideological. So we are not looking at what we share, but fixated on what we are different as a society. And the political, civil discourse and debate without assaulting the opponent is very rare. For me, as someone who came from a country without freedom, came to America, many years ago as a poor student, one of the things that I heard in America that was so great is that I may not agree with what you say, but I will defend to my death your right to say it. But unfortunately, our country is going away from the essence of freedom and mutual respect. So just like, when you have natural disaster like a tornado hit us recently, what we need is immediately best trained response teams. When the viral crisis like that happen, we find ourselves, we have to be already well prepared and trained to resolve our differences, to find a common ground and come together as a nation. And we are not prepared. So I think the biggest lesson we'll learn is that in peacetime, after this virus, we all need to change fundamentally, all of us, to learn how to find a common ground, how to listen to opponents, to learn how to find a way to resolve the gridlock, which is the hallmark of national discourse now. Because in this case, the viral crisis has brought us all together, indeed, found a common ground. And that is, this common ground is, we are also vulnerable. And we have no other choice but to find a way to work together as a human being. And I hope this will be a positive lesson we all learn from viral crisis and move forward as people and a nation, which are more willing to look for common ground, not just for crisis, but all solving our societal problems in general.
Thanks for your insight, Ming.
Thank you.
Yeah,
keep us posted on your Common Ground Foundation. We'd love to know how to support it, and we'd love to know how to properly promote it.
This is the life lesson today. It really is. And so is this pandemic, I think. It's a life lesson.
Yes.
Literally.
Again, Dr. Wang, we appreciate you. Appreciate all of our members and guests for the wonderful questions. We are going to have to reconvene with the CRC at a later date because we're running out of time. But I hope everybody has a wonderful rest of the day, a great weekend, and we will be meeting again next week. We'll send out details via email and text later on. But good to see you all. Take care, be safe, and we'll talk soon.
Thank you. Thank you.
Thank you.
Thanks, guys.
Thank you, Dr. Wang.
Thank you.
Great day, everyone.